mission is to inspire, educate, empower, and take charge of your health. If you are ready to embrace a healthier, happy life, hit that subscription button, girl. Hit that subscription button, like the video, share. Don't forget to turn your notification bell so that every time I post a video, you will be the first person to be notified. Today, we are talking about hypertension. Remember, we had talked about heart disease. Heart disease is just so broad that we cannot talk about everything in just one video. So make sure you follow this series. Hypertension is commonly known as high blood pressure. Is a medical condition. Hypertension is a medical condition characterized by consistent elevation of blood pressure level in the arteries, and it is often referred to as the silent killer because it may not present noticeable symptoms until significant damage has occurred to the heart and blood vessels. That is when you will realize that you have a blood pressure. So blood pressure or high blood pressure or hypertension or HTN is a silent killer. It is characterized by a consistent or persistent increase of pressure in the arteries. Yeah, that is what I'm trying to explain so that you get to understand what I'm giving you, what the information I'm giving you. So guys, understanding hypertension, you have to understand the normal blood pressure level. So normal is at 120 over 180. The systolic and diastolic. Huh? You get what I'm trying to say? The systolic and diastolic of 120 and 80. Elevated systolic is between 121 to 129, and diastolic is less than 80. Diastolic is less than 80. That is when we will say you have elevated blood pressure. Hypertension stages, we have systolic between 130 to 139 or diastolic of 80 to 89 or 80 to 89. Hypertension stage 1, that is stage 1. Hypertension, okay, we have hypertension stage 1, hypertension stage 2. Yeah, hypertension stage 1 and hypertension stage 2. So hypertension stage 1 is 130 to 139, and then diastolic is at least 90 or 90 and above. What am I saying? I'm trying to confuse you, and you have to stick here so that you get what I'm trying to say. Yeah? We have said normal blood pressure level is 120, 180. Systolic, diastolic. Elevated is elevated. When the blood pressure is elevated, is a systolic of 120 to 129, and diastolic of less than 80. We have hypertension stage 1 and stage 2, which systolic will be 130 to 139, and diastolic of 80 to 89. Yeah? 80 to 89. And then hypertension stage 2, at least 140 of systolic, and then diastolic at least 80, at least 90, not 80, at least 90. Then hypertension crisis. Hypertension crisis, systolic is over 180 and diastolic is over 120. And these require medical attention immediately. Require immediate medical attention. Did you hear that? It requires medical attention. Hypertension crisis is not something that you joke with. You are a nurse, you are a clinical officer, you are a doctor, you get a patient with hypertension crisis. Do something. Do something. You know what you're supposed to do. You went to school. You understood those things. You are in the field. You are practicing. You have to do something. Yeah. Here, we are empowering and educating those who have less knowledge. Doctors and nurses who are qualified and working in the hospital, those ones, they know what they are supposed to do. Them, when they are watching this video, they should act fast. If you're watching video and you are a healthcare provider, you get a patient with hypertension crisis and you don't do something, I think you want that patient to sue you. I'm not saying anything. Okay, what are the causes or risk factors of hypertension? Hypertension can be classified into two types: primary hypertension and secondary hypertension. So this type, primary hypertension, this type develops gradually over many years and usually has no identifiable causes. It can often link to genetics or environmental factors. It does not have a specific cause. Yeah, we have a secondary hypertension. This type is caused by underlying health condition. You have a DM or you have a diabetes mellitus, you can have this hypertension. You have a kidney disease, you can have this type of hypertension. You have any serious underlying chronic illness can trigger this hypertension type 2. Now, let's talk about common risk factors of hypertension. Age, number 1. Blood pressure tends to rise with age. As you age, blood pressure rises. That is why we advise mothers, if you are giving birth, give birth between 35 and below. Ikienda sana. Ikienda sana. Which means, if you have to wait longer, don't pass 40 years. Don't pass 40 years. Don't pass 40 years when you are still giving birth, because you will get what we call hypertension in pregnancy, or how do you call it? Preeclampsia, eclampsia, yeah, preeclampsia, because of age. When you are pregnant when you are too old, Hey, not too old when you have aged. Yeah, that is what I'm trying to say. Family history. If your father, your mother, your whatever, anybody who is close to you has ever suffered from this condition, then genetic can play a role in developing blood pressure. What are we advising? If you are at risk, don't put yourself at risk again by drinking alcohol, smoking. Yeah. Lifestyle factors is another risk factor. Poor diet, high salt intake, or high saturated fat, obesity, physical inactivity, excessive consumption of alcohol. There is no pride in drinking alcohol. There is no reward in drinking alcohol. Stop drinking alcohol because you are putting you are just putting yourself at risk of getting this condition. If you are already drinking, stop. Don't even reduce. Don't be told that you can just reduce. Just stop it. Stop it. Your body will adapt, even if you are a chronic alcoholic, addict, whatever. Stop it. Okay. The second risk factor we have said is common conditions. The common chronic condition. Yeah. If you have any chronic condition like diabetes, manage them so that you don't get hypertension. Okay. Are you getting what I'm trying to say? Are you getting what I'm trying to say? I think you are getting what I'm trying to say. Now, we have talked about hypertension. Now, what are the signs and symptoms? We've said that it is a silent killer because you will get an headache and you take that as just a normal headache and you take painkiller. The headache goes. Tomorrow you get it again, then you take painkillers, the headache goes. You continue taking painkillers and you have hypertension. You will die. If you have headache, go to the hospital. Get even, tell that doctor or nurse to just even take vital for vital measurements for whatever, for hypertension. Number 2, shortness of breath, nose bleeding. Those are nose bleeding. Can you go and check? Get out of here. Go and run to the nearest hospital and get checked. What is happening? Yeah? Can you run out of this classroom and go find what is happening? Flashiness and dizziness. Those are common signs and symptoms of hypertension. We've said headache, shortness of breath, nose bleeding, flashiness, and dizziness. Dizziness. If you are usually experience dizziness, get outside. You go and get checked first is when you come back and listen to this video until the end. Hypertension is diagnosed by measuring blood pressure with sphagometer. During your visit in healthcare center or in hospital, you usually see the nurses, the doctors, the healthcare provider taking blood pressure. It is important because you can come there with a headache, but and then your pressure is high. You are treating pressure with painkillers because you don't want to go to the hospital, and you can also not afford to buy this blood pressure machine. So at least I can say going to the hospital is more easier than even having this machine in the house, because sometimes you can have this machine and you don't know how to interpret the measurements. So it is important you once in a while you go get checked. Once in a while, please just go and get checked. Even you can just pass by and tell the person who is in the triage to just check. That is, it is even free. You don't need to pay something. Just tell that person, kindly can you measure my blood pressure? And if your blood pressure is high, that person will tell you to go and see. It is free. You don't need to go and pay something to get checked for blood pressure. Yeah, that is what I'm doing. In Kenya, it is free. Maybe if you're in another country, maybe you getting vital signs you can pay something. But I think if you're just going to check blood pressure alone, it doesn't need you to get you don't need to pay something. Treatment is about lifestyle because we've seen the causes. Medication, the doctor will give you medication according to diabetes that you're having. We have diuretics. Those ones doctors and nurses know about them. We have ACA inhibitors, we have calcium channel blockers, we have beta blockers. Those ones I don't need to talk about because they will not help you if you are here and you are not from health department. So for nurses, doctors, they know when to give diuretics, when to give calcium channel blockers, when to give beta blockers, and so forth and so on. Prevention, you already know the cause or the risk factors. Why don't you just have regular physical activities? Once in a while, go to the gym, sweat, burn that fat. Once in a while, manage stress. Don't have stress. Be a stress-free woman, a stress-free man. If it is a relationship that is putting you to be at what, to have stress, stop it. Live your life. Yeah, be happy. That is what I'm trying to say. Limit alcohol and avoid tobacco. In fact, I'm saying don't limit. Stop taking alcohol. Stop smoking tobacco. Yeah, stop talking alcohol and tobacco. Yeah. Eat healthy. Focus on low calcium options or diet. Managing blood pressure is crucial for reducing the risk of serious health problems, which include heart diseases, kidney diseases. So, it is that serious. Can you get outside of the class? We have finished the video and go and get checked for that blood pressure. Go and measure your blood pressure and know. At least, even once in a while. Do it even once in a year. It is important. You might be treating a headache that is hypertension. You might be taking antibiotics of shortness of breath. Maybe you think that you have some infection in your lungs. You're taking antibiotics, and you are having a problem with the heart. You are having hypertension. You are having high blood pressure. So get outside this class and go get checked first. Let's meet in the next video when you already know you have a normal blood pressure. Thank you.